10 warning signs of a blood clot that can't be ignored. In most of the cases, blood clots are beneficial. When you are hurt, your blood needs to clot and clump together at the spot to help stop the bleeding. However, clots can form when they aren't needed, which can be dangerous, especially if they develop in major arteries near your muscles. Blood clots that develop in this deeper system can be unpleasant and deadly. Deep vein thrombosis, or DVT, is the medical term for this type of clot. They act as obstacles on your blood highway, producing traffic jams and preventing the blood flow that keeps your system operating. Things might grow worse if a DVT escapes from its original location and goes to your lungs. Then it develops into a pulmonary embolism, which is a clot that prevents these important organs from receiving the oxygen and blood they require. This can be harmful to your lungs and other organs, and it can even be deadly. Some people are more prone to DVTs than others, so it's important to be aware of any risk factors. Furthermore, it is crucial to detect signs of a blood clot because they can frequently be minor or overlooked, and quick treatment is critical. Here are 10 warning signs of a blood clot to look out for so you can respond promptly if one occurs. Number 10. Swelling in one limb. When one of your limbs begin to swell, it might be a symptom of deep vein thrombosis or DVT. This sort of clot makes it difficult for oxygen to reach your organs, implying that you have poor blood circulation, which causes swelling. A portion of the clot may break off and move through your circulation, posing a risk. It might become lodged in your lungs and obstruct blood flow, resulting in organ damage or death. As a result, if the limbs on your body, such as your arm or leg, have begun to swell with no other cause, for example, there has been no damage to the limb, it might very likely be DVT. See a doctor as soon as possible. Have you ever faced any of these symptoms? What did you do then? Let us know in the comment box. And if you have anything in your mind regarding this episode, feel free to share it with us. We try to reply to every comment. Number 9. Limb pain or tenderness. DVT can cause discomfort in your legs or other afflicted limbs in addition to swelling. If there is no other reason for the discomfort, such as an accident, the soreness in your limbs might be a symptom of deep vein thrombosis. The limb may become sensitive to touch or pain. In addition to the swelling, you may have cramping in your leg or limb. Keep a watch out for limb swelling and pain, since these are early warning signs of blood clots. Number 8. Red streaks along vein. Blood clots can cause warm to the touch, red streaks on your skin. A streak should be very evident and run the length of your veins. When you touch them, you will notice that they are warmer than the rest of your skin. You could think that streaks are merely a rash, but if they are heated and run along your veins, you should seek medical treatment right away. Number 7. Chest pain and heavy breathing. Blood clots in the lungs may be dangerous, so if you have chest discomfort and are breathing heavily, you should immediately get medical assistance. Chest pain should never be neglected in the first place, but when it is accompanied by trouble breathing, it is something that should be addressed as quickly as possible. The most frequent consequence of DVT is pulmonary embolism, which happens when a clot or portion of a clot breaks off and lodges in the lungs. Shortness of breath and acute discomfort in the chest that worsens when you breathe deeply are symptoms of pulmonary embolism. A blood clot may rapidly become serious or fatal, so if you get both chest pain and heavy breathing, stop what you're doing and go to the emergency room. Number 6. Shortness of breath. If you find yourself having more difficulty in breathing than normal and becoming winded more frequently, this might be a symptom of a blood clot. Shortness of breath is frequently accompanied by dizziness and a racing heart, as well as a fluttering sensation in your chest. If you have all of these symptoms at the same time, you may have a blood clot in your lungs and should seek medical treatment right away. Number 5. Unexplained coughing. Of course, coughing is a common symptom of the flu or a cold, or even a sore throat after a night out. An unexplained cough, on the other hand, can be an early warning sign of a blood clot. If none of these things have happened, coughing may be accompanied by other symptoms, including shortness of breath and heart palpitations. If you have a persistent cough, look for other signs of blood clots. In addition to flu-like symptoms, vomiting and diarrhea can also be indicators of a blood clot. However, these symptoms are generally more severe and unexpected when it comes to a blood clot. If these symptoms do not improve within a few days, you should seek medical treatment. You might have a blood clot in your abdomen, which could be deadly if not treated. Number 3. Chronic headaches. Many people suffer from chronic headaches, but this pain will certainly be severe. In fact, they may be powerful enough to make you incapacitated and make it difficult to concentrate. You may also realize that taking medicine is not making any difference. It might be a symptom of a blood clot in your brain. According to one theory, migraineurs are more likely than non-migraine patients to develop hardened plaque or atherosclerosis in the arteries sooner. Atherosclerosis is a significant cause of stroke. The MRI did not reveal any more plaque formation in the arteries of migraine sufferers. Number 2. Feeling faint. Lightheadedness is caused in part by a chemical produced from the lungs, changes in blood oxygenation, and fluctuations in heart rate and blood pressure. The brain is sensitive to variations in oxygen and blood flow. Though it is not a typical sign of a blood clot, it can occur anytime. According to one study published in the New England Journal of Medicine, pulmonary embolisms were responsible for around 17% of hospitalizations for fainting among 560 older adults examined. Number 1. Blindness in one or both eyes. Either partially or completely. Sudden loss of vision without any accident in one of your eyes is generally an indication of a central retinal artery blockage. It is considered a major medical emergency, especially if you have other symptoms such as vertigo and trouble maintaining your balance. If you experience any of these symptoms, see a doctor as soon as possible. Remember that if a blood clot is not treated properly and quickly, it can be fatal. That's all for today. Hope you have enjoyed our video. For more interesting videos, please subscribe to our channel. Hope to see you in our next episodes. Till then, and take care.